So I'm going to talk to you a little bit about how we're restructuring ourselves to get into alignment with our community health improvement plan and some of these other efforts you've heard about today. Just to start out, I'd like to refer you back to your packet. In your packet, and if you haven't rearranged it a lot, it would be on the left side and the back are the articles of collaboration for the Health Action Partnership. And we, with some input from people in the different priority groups and some discussion at our leadership team, we made a few revisions back in September. I just want to point those out to you. This is important too, just because it does guide our work going forward. So on page 1, under item C, you'll see that we've adopted, this is a whole new section called Guiding Values. Equity and justice, collaboration, value of diverse perspectives, willingness to have candid dialogue, extremely important, and learning from failures and celebrating success. So just keep those in mind as we work together the rest of today. On page 2, at the end of Article 4, under priorities, this is a minor revision. It says that last sentence, priorities and associated goals are selected to sustain and leverage the Health Action Partnership's accomplishments to date and align with the current Jefferson County Community Health Improvement Plan. Okay, that used to say the Roadmap to Health, which was a previous community health improvement plan that was done 2005-2006. So this just makes it more generic, more enduring as we go forward. Then on page 7, there's some changes in the discussion about priority groups. And I won't go through all of that, but basically, in listening to the people in our priority groups, we made some changes just to make the priority groups have more autonomy. And that seemed to be a very important move, and we're all in agreement with that. Okay, so earlier I took you through that whole MAP process, Community Matters 2020, and then the different strategic issues. So just to back up a little bit, you also heard earlier about our different priority groups. They reported out. So on the left of this slide, you see our current 4 priority groups. And these were put into place in 2012, coming out of the really big grant that we had, Community Putting Prevention to Work grant, which was focused on obesity and tobacco. So there was a restructuring that occurred at that time that gave us our current priority groups. And so now we're in the process of mapping those 4 into our new strategic priorities. And so you'll see the arrows here and how this goes. So on the right of your slide, you have our 5 strategic issues that came out of our Community Health Improvement Plan, or that are our Community Health Improvement Plan. And you'll just see how these are mapped. So that first one, promote physical well-being through healthy lifestyles, you'll see that incorporates really the majority of the work that we have been doing through our current priority groups. So healthy food choices, tobacco-free task force, healthy children and youth essentially map to that strategic issue. And so that will be a new priority group that has a whole lot of stuff under it. And just as you discuss this going forward, these priority groups, as I mentioned, have more autonomy, so they will have to figure out sort of how to do the substructure. Do you have subgroups, or how do you want to do all of that? So we're not trying to, I want to really emphasize, we're not trying to dilute out the work that anybody is doing or make anybody lose focus. Like if you're really, really focused on tobacco and that's your thing, we're not telling you that you've got to dilute that out. I hope that's really clear. We want you to continue as you're doing, but it's just part of this new structure. Then livable communities, the fourth one, some of that focuses on lifestyle issues, like the walking cards and engaging the community around walking and encouraging lifestyles. So that part would fit well under the first of these, Healthy Lifestyles group. But there's also a component of healthy community which is about the built environment, like our trail system, like bike lanes. And so that would map more to this second strategic priority, optimize the built environment, transportation system, and safety. And then we have 3 whole new strategic issues, which are all big issues. So we are forming 3 new priority groups under our Health Action Partnership. So this is from today going forward. And so you see those there. Again, optimize healthcare access, improve mental health, and reduce health disparities. And this is just another way we want to look at this. And we had a meeting to help. We had a meeting a few weeks ago to work all this out, to sort of plan this. We had a very good discussion with our priority group leaders and our leadership team working together about this, and there was quite a bit of discussion about health disparities. Yes, that's a separate strategic issue that we have identified, and again, I remind you that was number 1 in terms of the votes that we got. But we were also concerned that if you put that in one silo, that the good part about that is you have some people really focused on that, and we need some people really focused on that. The liability there is that other people will say, oh, those people are handling that issue. And we don't want that to happen. We want the issue of health equity to permeate everything that we do, okay? So this is just one way of sort of helping you visualize that, is that the health disparities gear here sort of turns with all the other gears. And you could probably come up with a zillion other designs or pictures to sort of do that. And how this works exactly, we don't know yet. That's another part of the discussion. But we just want to emphasize this, that the health disparities group might have some laser focus on some issues that they're going to carry, but in some way they're going to have to help encourage the other groups to really focus on health equity. Okay, yeah, another thing I just wanted to mention, and I'll back up to this again. In your breakout sessions and going forward, the priority groups are free to rename themselves, okay? When you look at our community health improvement plan and our 5 strategic issues, they're sort of a mouthful. The reason they're a mouthful is because we wanted to make sure that there was a more thorough understanding of what we were really about. If you narrow it down to one word, it's a little too vague, okay? But for the purposes of just structure and organization, having a name for yourself, I think we'll have a shorter version just so we're not always having to blurt out a big mouthful. People will shorten it anyway if we don't do it for them. So you may want to think about this a little bit, how you want to name them. I know in particular health disparities, it has been suggested, I think a fair amount of people agree that maybe we should call it health equity. And more of a positive thing. This is what we're shooting for rather than focusing on the negative. And there are other reasons that Monica Baskin, I'm sure, could explain to you why that's important. Another thing that you might have noticed when Drew Langlow was giving his bold goals presentation of that overarching structure for the different counties was a community engagement piece. And this is another thing I really want to emphasize. We're not going to be we're not addressing that today. That's not one of the breakout sessions. But I just want to acknowledge that over time, we have recognized, and some of this came out of the Bold Goals group discussion, that because the Health Action Partnership is composed of agencies or organizations, and there's a reason for that, is because we want to make sure that we have capacity to get the work done. But there's a downside, and that is that individuals who don't represent an agency can potentially get left out. And the communities that we're really wanting to serve in terms of health equity in particular might be prone to get left out. So the communities we're really trying to serve don't always have a place at the table to help inform our work and keep us honest in our work, or help us really know what is reality down in the trenches or in the neighborhood and family level, as opposed to up here in the sort of ivory tower kind of conceptual level. So we are forming a task force to figure out how we're going to do the community engagement piece. We don't know yet what the best way to do that is. One challenge is that we have a lot of different communities in Jefferson County. We have over 30 different municipalities. We have over the mountain, we have inner city, we have rural. We just have a whole bunch of stuff. So how to do that is going to be a challenge. But there's a task force that will be working on that. But I will say that will be made up of people that represent the community as opposed to organizations. And they will have representation on the leadership team of the Health Action Partnership. Okay? And that's about all we know about that so far. But just rest assured, that's something we're going to be working on in the near future. We are recycling, so your name badges and lanyards we'll use again. Any papers or folders that you know you're not going to look at again, turn them back in at the registration desk so that we can recycle. And I just want to ask, did I miss anything? Bryn or Monique? Did we cover it? All right. Thank you so much.